there's a quiet truth we don't often admit out loud. In a country as ambitious, as restless, as stubbornly hopeful as ours, trust is still the most fragile thing we possess. And in 2025, as America wrestles with vaccines, again, not the science of them so much as the belief in them, you can feel that fragility stretching thin because trust doesn't break with a bang. It erodes with whispers. A rumor forwarded, a headline stripped of context, a fear dressed up as certainty. And before long, something meant to protect us becomes another battlefield in a culture already worn down by too many. Most people overlook this. But we've reached a moment where misinformation travels faster than any virus ever could, and sometimes cuts deeper. So the real question isn't just whether vaccines work, we know they do, but whether we still believe enough in one another to let that truth guide us. If we look back at how we got here, the story is messier than any chart or report. After the pandemic years, with all their grief, confusion, and political noise, Americans were exhausted. Then came the breakthroughs. mRNA platforms maturing, real-time safety systems humming in the background like quiet guardians. We saw innovation that would have seemed like science fiction when I was a young man reading about polio campaigns. But alongside these triumphs grew a new kind of storm. Digital echo chambers where fear metastasized into certainty, communities fractured by competing realities, policies shifting from one state house to another, creating pockets of protection and pockets of great vulnerability. And as measles crept back into headlines, a disease we had once declared defeated, we were reminded that progress doesn't just advance, it can retreat if we stop tending to it. Health workers started fighting on two fronts: the biology of disease and the psychology of doubt. And in town halls, hospital corridors, church basements, they kept talking, kept listening, kept nudging the truth forward, one conversation at a time, even as the noise outside grew louder. I've seen that kind of work before. When I was organizing on the south side of Chicago, trust wasn't something you demanded, it was something you earned, slowly, over late night meetings and early morning walks through neighborhoods that felt forgotten. Later, in the White House, during moments when the nation was anxious about an outbreak or an economic scare or some policy tangled up in anger, I learned that leadership is less about delivering answers and more about offering steadiness. You show up, you explain what you know and what you don't. You let people see you wrestle with the facts instead of pretending you've mastered them from the start. And sometimes, even with all that, folks still doubt you. I remember briefing rooms where we'd share clear evidence, and afterwards somebody would say they heard something different on a talk show. I'd smile a little tightly, maybe, and remind myself that democracy means people will always test the truth for themselves. That's part of the deal. But it also means we have a responsibility to keep telling the truth anyway, to keep at it even when it feels like pushing against the tide. When I think about vaccines now, I don't just see syringes or vials. I see the deeper tension running through American life, the tug between personal choice and shared duty, the way our freedoms mean something only when they consider the well-being of others, the moral paradox that some of the technologies most capable of saving lives are also the ones people fear most. And that fear, if left unattended, can leave our youngest and oldest, those who depend on the rest of us, exposed to unnecessary harm. There's also a broader lesson here about human nature. We are creatures of story more than statistics. We respond to empathy before expertise. And in a world where falsehoods are engineered to be louder than facts, truth requires patience and courage. Progress doesn't scream, it whispers. It's built in labs by scientists who rarely seek credit. It's carried out in clinics where pharmacists counter conspiracy theories with compassion instead of contempt. And it shows up in communities where people decide quietly that caring for their neighbor is more important than winning an argument online. Democracy, at its best, is just an agreement to keep choosing one another over fear. So as we stand in this moment, with new technologies on the horizon, with policy debates raging, With misinformation swirling like dust in the wind, I come back to the same belief that's carried me through the hardest chapters of public life. Hope is not a feeling, it's a decision. A disciplined commitment to meet fear with clarity, division with dignity, and uncertainty with the stubborn insistence that we can do better. If vaccine confidence is shaken, we rebuild it the same way we rebuild anything worth keeping, through honesty, humility, and the slow work of earning trust back. And if our democracy feels unsteady, we steady it by remembering that truth is not a weapon, it's a bond. It ties us to one another. It keeps us whole. The challenge before us isn't just about shots and arms. It's about the kind of nation we want to be when the noise fades. Do we choose truth even when lies feel easier? Do we protect the vulnerable even when no one is watching? Do we still believe deep down that our shared humanity is stronger than the fear that tries to divide us?